Okay, here let's say invite out the third interviewer of the day. So, doctor, could you do a brief introduction for yourself?
Yeah, my name is Dr. 𝐤𝐤𝐞𝐫 𝐤𝐵, and I have Master of Science in Lasers and Dentistry. So actually, I also have PhD in this field, and I'm assistant of professor of People's Friendship University of Russia, Moscow, and I'm clinician. And in my daily practice, I cannot imagine myself without usage of lasers, because it become for me very essential tool in everyday practice.
Okay, yeah. Dr. Yulia, so what is your maybe experience on our laser, Woodpecker laser?
Yeah, so I actually use it, and it's very helpful, because in one device of laser we have 3 wavelengths, which is indicated for different kind of procedures and outcome. So actually for example, when I need to do pain management for the patient, I use it 1 wavelength. When I have to do some kind of surgical, minimal invasive surgical procedures, I also use it with a wavelength of 450.
Yes.
So when I need to do root canal treatment for disinfect the root canal, I also choose this device, but another wavelength. So that's actually has a spectrum of the wavelengths, which is really needed for the everyday practice of the dentist, So.
I see. So in your opinion, what could be the most important advantage of laser compared to
compared to traditional way of treatment, especially for the acceptance of patient and of the healing process for the patient. So actually the laser is amazing devices, and worthwhile in everyday practice. It's implemented more and more for different indications. But in cases of treatment of the pain, such as TMG disorders, of course, first we have to understand what is the cause, right? But for the symptomatical treatment, to remove the pain, to help for the patient, so we use it. And orthodontical movements in the treatment also, we use it very much, BPM. So for the low-level laser therapy, for the treatment of dentin hypersensitivity, so that's very helpful symptomatical treatment, and that was also my thesis for the PhD. So and patients, they're accepting that very much, because for someone who has the experience for traditional treatment of extraction of the wisdom tooth of the third molar, and then they did laser assisted treatment, they can compare, and they coming back for some other kind of treatments. Even for professional oral hygiene, they ask me, doctor, will you use laser or not? Because I really enjoyed the process, the healing one. He can compare, and they're already asking for the laser assisted treatment, because they know it's much easier. They are not taking antibiotics after the surgery. They're not taking painkiller. It's just fine. I also just two weeks ago I experienced the wisdom tooth extraction, and just the healing was perfect, So on myself, I always tasted some stuff, some new stuff. So that's just really amazing.
I see. So from the answer that you gave to us, I always hear about the patient. So I'm assuming that you are really taking care of your patients.
True.
Yeah,
I do.
So maybe for how is the feedback from your patient after using the laser?
They're just amazed, because they're like, doctor, can I have the treatment with a laser? Also, sometimes we have cold time in Russia.
Okay.
And a lot of patients, they experience cold sore.
Okay.
Actually, that's contraindication for do any procedures. And the patient, they book an appointment, and they come in, maybe, they have work, but instead of this, they come in for treatment, but it's not actually indicated when patient has, because it's virus.
I see.
So any treatment, what should we do? So to tell the patient, sorry, we cannot, they're sad, but in this time I take my laser and I do treatment for cold sore. And actually the patient who has this, it's appearing again, and they're having the pain. So especially when it's a period, depending the stage of development of this disease. So actually they're coming and said, okay, sorry, we cannot do real treatment. What you came, I mean, maybe caries treatment or endodontical one, but I can help you. So we will treat the core sore, and the healing process, it will decrease time, so you will come earlier when you normal treatment, antiviruses. So actually it's also accepted by the patient. He book appointment. We cannot provide the treatment because it's contraindicated, but I do the treatment. So and the laser is very good against cold sore, and in the same place where it was, usually it's appearing again for the traditional way, but in the usage of lasers, never ever it's appeared on the same place.
I see.
You know, so we do the systematic, let's say, treatment. So it's very essential tool, and patient understand while you explain, he's not sad anymore, and we provide the care for him. So even in this case, it's very helpful. So now the lasers implemented in the medical field, not only in the dentistry. Patients are reading a lot of social networks, and they are coming and they're asking, do you provide this type of care? So it gives us benefits as a clinician, you know. So that's very good, accepted by the patients.
So it gives maybe benefits both for the patient and
for the
doctor.
clinician. Yeah,
yes,
that's true.
Yeah. So maybe what could be the most common maybe, I would say, what is the most common procedure that you're using right now with the laser?
If we're speaking about the diode laser, so it's for me it's very oftenly used for pain therapy, different kinds. For example, in the cases when I need to open impacted tooth and orthodontist should apply the braces in the same visit, not to wait. So very perfect. In the time when, for example, it was the tooth was for a long time broke, and we have gingiva over it, and I need to clean it outside and to build up for future maybe crown. So usually it takes time to build up because it's bleeding and I cannot perform good build up. But according usage of diode laser to remove the gingiva, so in the same visit I can build it up, so it saves my time, it saves patient time. So for coagulation effect, so actually that's most usage, and of course endodontical treatment for the disinfection of the root canal, for the good prognosis for the endodontical treatment. That's the most commonly used, these free indications.
I see. So you're using a lot for a lot of different maybe.
True.
Okay. Yeah. And then maybe talking, currently I still feel a lot of dentists, they are afraid to using the laser.
True.
So what is your advice for those doctors have not ever tried laser before?
To try, that's true.
To try.
Yeah, but another thing, it's education. That's the important point for the usage of lasers. When you understand some rules, how to do it, how it's influenced, what is tissue interactions, so what are chromophores, for that it becomes easier. When they see some publications which is properly done and it's really proven, then they see some clinical cases. So first of all, they have to want to use it, because if doctor don't want, that's another tricky. So and another thing, the education is the most important thing, and straight away after education you have to start. And all this, when I provide education for the clinicians, I told them, please use the lower parameters. Start with a lower parameters to protect yourself, not to worry. And then when you see, you can increase it a little bit. So that's some rules which should be done. And they have to have some supporter clinician who can help them or advise in case they still need it. But it's amazing tool which helps us to improve the outcomes.
I see. So maybe how you see maybe the trend for the laser? Is this more and more doctors get used to it, or?
Yeah,
how?
Sure. It's increased the spread of the lasers in the world for the dentist. It's spreading because it helps. So it's an essential additional tool which really helps, and sometimes it's just does the magic. Yeah, true.
Gotcha. So maybe maybe in one sentence, how would you summarize the Dow laser, the value of Dow laser right now for the
laser is a miracle for someone who has the knowledge.
I see. Okay. Yeah, that could be all for today's interview. Thanks for all the time. Thanks for all the insight, sharing maybe all the information with our audience. Thank you.
Thank you.
Yeah. So today, maybe here we come to the end of today's interview. Thanks for all of our speakers for their valuable insight, and thanks for everyone to join us, and thanks for your continued support. Thank you.